start the treatment with a consultation. Discuss the desired length, thickness and style. Make sure your bed is properly prepared for your client and that you have all equipment ready for the treatment. If you use magnifying glasses, check to make sure they are correct for your eyes. Remove all traces of your client's makeup using our eyelash remover pads and our non-oily cleanser. Get your client to look back and place the anti-wrinkle gel patch over the client's bottom lashes. Make sure you cover them completely so the top lashes cannot touch them and stick together during application. If any lashes are sticking out, use surgical tape to hold them down. Once both pads are on, ask your client to close their eyes and keep them closed throughout the treatment. Also advise them not to talk during the treatment as this causes movement and will possibly move the eye pads. Put on some soothing music and let this be time for your client to relax. Place the surgical tape over the brows. This slightly lifts the lashes off the pad for easier application. This can be moved throughout the treatment. Place the U-band eyelash extensions holder on your finger with the 3 lengths you have chosen. Make sure they are the right size and curl for your client. The U-band holds the lashes upright so they can be picked up with ease and precision for quicker application. You should be using a minimum of 3 different sizes. 1 size for the inner corner of the eye, 1 for the main bulk of the lashes, and 1 for the outer lashes. These sizes should go up in 2 for a more natural look. On another finger, put the smart ring glue holder with a small amount of glue. Always make sure that you wipe the bottle clean before replacing the cap, as this will ensure the glue does not dry out. Before starting the treatment, apply pre-treatment with a microswab. This pre-treatment will prepare the natural lashes for maximum bonding. Now use an eyebrow comb to separate the natural lashes evenly. When picking up a single false lash with the tweezers, make sure the tapered end is pointing up. Dip the blunt end of the lash into the glue and run it through 2 or 3 times. Try to get 2/3 of the lash in the glue to ensure maximum adhesive. With your other hand, you will need to separate one single natural lash to place the false one on. Rub the false lash against the client's natural lash and place about 1 to 2 millimeters from the eyelid. The glue should not come into contact with the skin. Hold the lashes separate for a few seconds to ensure no other lashes will stick to it. If you do not separate the natural lashes, you can cause the lashes to stick together in clumps and damage the client's natural lashes. If your client has gaps in their lashes or very few lashes, you can use our selection of Y, W and V lashes. These knot-free lashes are bonded together in the shape of the letter stated. These lashes come in 0.12 mm by 12 mm and can be trimmed if needed for shorter areas. As they are only 0.12 mm, there is no chance of them damaging the client's natural lashes. They can also be used to make a set fuller for a more dramatic look. Use a reasonable amount of glue, not too little. If there is too little, the lash will not stay on for long. If there is too much, the lash will become too heavy and damage the client's natural eyelashes. This will come with practice. If your client has very sensitive eyes, make sure you are using the sensitive glue or soft glue. These glues have less fumes, which equals less irritation for your client. Glue needs to be stored in a cool, dry place. If stored in the fridge, it will need a few hours to bring it back to room temperature before use. We also supply 4 different types of tweezers depending on therapist's comfort. If there are a few excess bubbles on the lashes, they can be smoothed away with an upward motion of your tweezers. Also make sure that you clean your tweezers with glue debonder throughout the treatment so that the false lashes do not stick to them. Once you have applied several lashes, use the air blower for about 15 seconds to fix the glue. Continue doing this after each new section of lashes. Complete the work on one eye before starting on the other. Once the whole process has been completed, use the air blower or a mini fan to remove fumes from the glue. This will take about 3 to 5 minutes. Make sure no eyelashes have stuck to the bottom pad. If so, flick them up with the point of the tweezers. After the application, apply after-lash coating to protect the lashes from oil and moisture. This will not only extend the life of your client's lashes, but also gives the lashes a more vivid look. The after-lash coating can be used daily and is easily washed off with water. Now remove the surgical tape and pads. If your client feels any stinging or their eyes are watering, blot with a tissue and use the air blower or fan for a few more minutes. Your client can now open her eyes. Give them a mirror and show them their new eyelashes.